Hello everyone, welcome to BioTales. Today we are going to discuss about kennel cough. Kennel cough is also known as canine infectious respiratory disease (CIRD). The disease results from inflammation of trachea and can progress to bronchopneumonia in puppies or chronic bronchitis in adult or aged dogs. It is highly contagious respiratory disease. It can spread quickly among dogs who live close to each other, like in veterinary hospitals, doggy daycare, boarding facilities, and kennels. Dogs of all breeds and ages are susceptible. Puppies are most prone to severe disease. Let's see that how kennel cough sounds like. The kennel cough sounds like a forceful hacking cough. It sounds like something is stuck in your dog's throat. It can be dry, hoarse, or productive, means the cough with mucus production. This cough is distinct from reverse sneezing. Now let's see what are the causes of this disease. Kennel cough is caused by bacteria called Bordetella bronchiseptica. It is often referred to as Bordetella. Most dogs infected with Bordetella are also infected with virus at the same time. These viruses include canine adenovirus, canine distemper virus, canine herpes virus, canine influenza virus, parainfluenza virus, and canine reovirus. Dogs inhale bacteria or virus particles into their respiratory tract, which is typically lined with a mucus coating. However, factors such as crowded or poorly ventilated conditions, cold temperatures, exposure to dust or cigarette smoke, and travel induced stress can weaken this protection, making dogs more susceptible to kennel cough infection. Bordetella bronchiseptica may act as a primary pathogen, especially in dogs under 6 months old. However, this and other bacteria may cause secondary infection after viral injury to the respiratory tract. Let's see what are the signs of this disease. The incubation period of kennel cough is 5 to 7 days. Incubation period is the duration between the animal first exposed to the causative agent like bacteria and virus and the appearance of the symptoms. The duration between these two incidents is called incubation period. The signs and symptoms of kennel cough include harsh dry cough. Coughing generally worsens with the activity or exercise, which can irritate the airways. Not all dogs with CIRDC will have a cough. There are some other common signs that include sneezing, retching. Retching means to react in a way as dog is vomiting. Snorting means the sudden explosive sound through the nose. Vomiting in response to light pressing of the trachea or after excitement or exercise. The presence of fever that varies from case to case, and runny nose or eyes. In most cases of CIRDC, the illness is mild and dog fully recover within 7 to 10 days. However, depending on the infective organism and the dog's ability to fight them, some dogs may develop more severe signs like lethargy, means tiredness, decreased appetite, fever, productive cough, and rapid or labored breathing, which can signal that bacteria have infected the lungs and has caused bacterial pneumonia. Dogs in which canine distemper virus is one of the infecting organism may also have gastrointestinal signs like vomiting or diarrhea, hardened foot pads, and neurological signs like head tilting or circling behavior. These dogs, as well as puppies and older dogs with other health problems, are at greater risk of severe disease and even death. Let's see how kennel cough can be diagnosed. Kennel cough is a common condition that can be diagnosed by veterinarian. If your dog has signs or symptoms and has been exposed to other dogs, it is usually sufficient to diagnose them with kennel cough. Nasopharyngeal or tracheal swab may be taken for PCR testing to determine the cause of illness like bacteria or virus. There can be some complications, therefore Radiographs are also important to assess a dog's condition. If your dog is bright, perky, eating well, and playful, you may not need to visit the vet. However, if you are worried and want advice, call the clinic and inform them of your dog's coughing. It is best to keep your dog away from other dogs while they are coughing. Now let's see how this disease can be treated. Kennel cough can be treated with rest and supportive care for a week or so. However, a veterinarian may prescribe antibiotics to prevent secondary bacterial infection and cough suppressant medication to ease symptoms and help the dog to sleep. Nebulizer and vaporizers using inhaled antibiotics or bronchodilators have been reported to be beneficial but are usually not prescribed. In most cases, dogs will recover from kennel cough without treatment within 3 weeks, but it can sometimes delay it for up to 6 weeks. To aid recovery, ensure your home is well ventilated and avoid using a collar and lead to avoid irritation of the tracheal area. Let's see how this disease can be prevented by using vaccine. The Bordetella vaccine helps protect against kennel cough, but it does not prevent in all cases because different viruses can also cause it. The vaccines comes in 3 forms: injection, that is shot under the skin; nasal spray, that works faster and the protection starts within 4 days; oral, which is given by mouth. Puppies can get the nasal vaccine as early as 3 weeks old. Many boarding kennels require this vaccine. Dogs should also get vaccines for distemper, parainfluenza, and adenovirus (CAV2). Puppies need their first shot at 6 to 8 weeks, with the booster every 3 to 4 weeks until 14 to 16 weeks old. Adult dogs need yearly boosters. Your vet will recommend the best vaccine based on your dog's lifestyle. For example, if they go to the dog park or boarding. An influenza vaccine may be needed if dog flu is common in your area. Vaccines are the best way to protect your dog. If your dog cough or seems sick, keep them away from other dogs and see a vet. Thank you.